Every morning, before the sun had fully risen over Vienna, a priest walked the same corridor. He carried last rites. And in 1847, in one of the most prestigious hospitals in the world, he made that walk almost every single day. The Vienna General Hospital was not a place of last resort. It was the finest maternity institution in Europe. Doctors trained here from across the continent. The equipment was modern. The staff were educated. The building was grand. And yet, women were begging not to be admitted. Not because of poverty, not because of neglect, because of a number: 1 in 3. 1 in every 3 mothers admitted to the first obstetrical clinic did not leave alive. They arrived carrying new life, and within 48 hours, many were gone. Fever, chills, a swelling in the abdomen, then organ failure, then nothing. The disease had a name: puerperal fever, childbed fever. And in the spring of 1847, it was killing women faster than any war, any plague, any famine in the city's recent memory. The doctors had theories, of course. They blamed the air, miasma, they called it, bad vapors rising from the ground. They blamed the weather. They blamed the women themselves, their constitution, their anxiety, their weakness. Nobody blamed the doctors. And why would they? These were the finest medical minds in Europe. Men who had dedicated their lives to healing. Men who genuinely believed they were doing everything right. They had no idea they were the ones carrying death through those wards. But one man noticed something. Something so simple, so obvious in hindsight, that it would take the medical establishment another 20 years to accept it. His name was Ignaz Semmelweis. And what he discovered didn't just solve the mystery of childbed fever. It should have saved hundreds of thousands of lives. So why did the world refuse to listen to him? Ignaz Semmelweis was 29 years old when he first sat down with the numbers. Not because he was assigned to, not because anyone asked him to, because something wasn't adding up. The Vienna General Hospital ran 2 maternity wards. The first clinic, staffed by doctors and medical students. The second clinic, staffed by midwives. Same building, same city, same patients, same year. And yet the first clinic, the doctor's ward, had a mortality rate of 18%. The second clinic, the midwives' ward, had a mortality rate of under 4%. Semmelweis stared at those numbers for weeks. And the more he stared, the more one question consumed him. Why? He began eliminating theories, methodically, one by one. The first theory: overcrowding. The first clinic was busier. More patients, more risk. Semmelweis checked the records. The numbers didn't support it. The second theory: the birth position. Women in the first clinic delivered on their backs. Women in the second clinic delivered on their sides. Some colleagues were convinced this was the answer. Semmelweis tested it. Changed the position in the first clinic. The death rate didn't move. The third theory, and this one is difficult to say without anger, was the priest. When a patient in the first clinic was dying, a Catholic priest would walk through the ward to administer last rites. Bell in hand, robe flowing, past every bed. Some of Semmelweis's colleagues genuinely believed the psychological distress of seeing the priest, of knowing death was walking toward you, was enough to trigger the fever in other patients. So, they rerouted the priest. The death rate didn't move. By the winter of 1846, Semmelweis was running out of theories, and the women kept dying. And then, in February 1847, something happened that had nothing to do with the maternity ward at all. A colleague of Semmelweis, a respected pathologist named Jakob Kolechka, was teaching an anatomy class when a student's scalpel accidentally punctured his finger. A small wound, barely worth mentioning. Within days, Kolechka developed a fever, then the chills, then the swelling, then the organ failure. Jakob Kolechka died from the same symptoms as the mothers in the first clinic. Not from childbirth, not from pregnancy, not from miasma or bad air or psychological distress, from a scalpel. That had come from an autopsy table. Semmelweis went cold, because he knew exactly what that meant. The doctors and medical students in the first clinic began every morning in the autopsy room, dissecting cadavers, studying disease, learning their craft. And then they walked directly to the maternity ward. The midwives in the second clinic performed no autopsies. They went nowhere near the dead. The doctors were carrying something from the corpses to the mothers, something invisible, something they couldn't see, couldn't smell, couldn't measure with any instrument available to them in 1847. Semmelweis called it cadaveric particles. We now call it bacterial contamination. He had his answer. After months of dead ends, crossed out theories, and sleepless nights, he had his answer. And it was almost insultingly simple. The most sophisticated medical institution in Europe was killing its patients because its doctors weren't washing their hands. Now all he had to do was convince them. In May 1847, Ignaz Semmelweis made a decision that would change the history of medicine. He placed a basin of chlorinated lime solution at the entrance to the first clinic, and he told every doctor, every surgeon, every medical student, before you touch a single patient, you wash your hands in this basin, not with water, with this, chlorinated lime, calcium hypochlorite. He chose it specifically because it eliminated the smell of the autopsy room that clung to doctors' hands even after rinsing with water. If the smell was gone, he reasoned, the particles were gone. The results were not gradual, they were immediate. May 1847, 18%. June 1847, 12%. July, 6%. August, 3%. By the end of 1847, after 7 months of mandatory hand washing, the mortality rate in the first clinic had fallen to just over 1%, from 18% to 1.27%. In 7 months, without a single new drug, without a single surgical advance, without any equipment the hospital didn't already own. Just a basin, and a solution that cost almost nothing. Women who would have died, lived. Infants who would have been born into grief, went home with their mothers. The priest walked the corridor less often. By any measure, by any standard of evidence, this was one of the most significant medical discoveries of the 19th century. Semmelweis had the data. He had the results. He had the proof playing out in real time on the ward beneath his feet. And so he stood before the medical establishment of Vienna and presented his findings. The numbers, the methodology, the results. 18% to 1%. Right there in the ledgers. Undeniable. The room was quiet for a long time, and then, one by one, they began to object. The theory was too simple, they said. Medicine was not simple. It implied that doctors were responsible for their patients' deaths. That was unacceptable. Gentlemen did not carry disease. Gentlemen were healers. And besides, there was no scientific mechanism to explain it. No proof of what these so-called particles actually were. Germ theory did not yet exist. Louis Pasteur was still a decade away from his breakthrough. Without a mechanism, they argued, the data meant nothing. He wrote to hospitals across Europe. He documented everything. He published. Some colleagues listened. A handful of institutions trialed his methods. Their mortality rates fell too. But the medical establishment, the men with the power, the positions, the reputations, closed ranks. They did not just ignore him, they attacked him. And with every attack, with every dismissal, every mocking journal entry, every colleague who refused to implement a protocol that was provably saving lives, something in Semmelweis began to break. He had watched women die. He had stopped women dying. And the people who could have spread his discovery across the world chose not to. That knowledge, that the deaths were preventable, that they were continuing, that he was being ignored, became unbearable. In 1865, Ignaz Semmelweis was committed to a mental asylum. He was 47 years old. He died 14 days later. He never knew that he was right. Every clinical professional in the world today is taught the same thing on their first day of training. Wash your hands. Before patient contact, after patient contact, before a procedure, after a procedure. It is so fundamental, so completely embedded in modern healthcare, that most practitioners do it without thinking. In a modern maternity unit, the mortality rate from puerperal fever is close to zero. Not because we are smarter than the physicians of 1847, because we listened, eventually, to a 29-year-old doctor who placed a basin of chlorinated lime at a door and watched the death stop. It took the medical establishment 20 years after Semmelweis's death to formally accept what he had proven with data in a single season. 20 years. It took the medical establishment 20 years after Semmelweis's death to formally accept what he had proven with data in a single season. 20 years. In healthcare, we have a name for what happened to Semmelweis. I want to stop here for a moment. We call it because this is the part of the story that I find most difficult to sit with. The instinctive rejection of new information, not as a historian, new evidence, but as a clinician. New data, new findings. Because accepting it would mean confronting something uncomfortable, that the old way was wrong, that harm was caused, that we, the professionals, the experts, the people trusted with lives, made mistakes. I have seen it in my own career. Most clinicians have, if they are honest with themselves. It does not always look like arrogance. Sometimes it looks like caution. Sometimes it looks like rigor, demanding more evidence, more peer review, more time. Sometimes it looks entirely reasonable from the inside. But when the data is clear, when the results are sitting in front of you, undeniable, and the response is still resistance, that is the Semmelweis reflex, and it costs lives. I want to stop here for a moment, because this is the part of the story that I find most difficult to sit with, not as a historian, but as a clinician. In healthcare, we have a name for what happened to Semmelweis. We call it the Semmelweis reflex, the instinctive rejection of new information, new evidence, new data, new findings, because accepting it would mean confronting something uncomfortable, that the old way was wrong, that harm was caused, that we, the professionals, the experts, the people trusted with lives, made mistakes. I have seen it in my own career. Most clinicians have, if they are honest with themselves. It does not always look like arrogance. Sometimes it looks like caution. Sometimes it looks like rigor, demanding more evidence, more peer review, more time. Sometimes it looks entirely reasonable from the inside. But when the data is clear, when the results are sitting in front of you, undeniable, and the response is still resistance, that is the Semmelweis reflex, and it costs lives. The World Health Organization estimates that healthcare-associated infections affect hundreds of millions of patients globally every year. Hand hygiene compliance, even now, even with everything we know, remains one of the most persistent challenges in modern clinical practice. Semmelweis solved this problem in 1847. We are still working on it. Every time a clinician washes their hands before touching a patient, every single time, in every hospital, in every country in the world, they are continuing the work of a 29-year-old Hungarian physician who died in an asylum, alone, dismissed, and certain that he was right. He was. Ignaz Semmelweis. Born 1st July 1818, Buda, Hungary. Died 13th August 1865, Vienna, Austria. Cause of death, disputed. Possibly the same infection he spent his life trying to prevent. Medicine remembers him now. Statues, hospitals, medical schools, all bear his name. But the women of the first clinic, the ones who died before he found the answer, and the ones who died after, while the establishment argued, "They have no statues. They have only this." If this story stayed with you, it should. Share it with someone in healthcare. They will understand exactly why it matters. I'll see you in the next Chronicle.